Hello, I'm Shelley Paul, and I'm going to be presenting my project, my education project on oral health in Alta Loma. I chose this neighborhood for my underserved community because this neighborhood is in Oceanside, and I live in Oceanside. So I wanted something around it in my city that I could go there frequently, drive around the neighborhood, and really get a good feel for it. And this neighborhood was also recommended by my preceptor, Debbie, who is in the San Diego County Public Health Office, and she worked in that area. And so that was one of the factors in choosing this. The health issue that I had chose to do was oral health care in the adult homeless population. And when you're dealing with the homeless population, there's a variety of I guess you would call health issues that do come up. Many are homeless individuals have mental health issues, the poor dental, they have substance abuse, and a lot of them are not eating properly, and that will also contribute to poor oral health. So the background and significance of this is what I found was families and children have many options for oral health care, although the single adult homeless individual does not. And so that was, one of the reasons I wanted to do this for just, I'm actually focused on the single adult homeless. Father Joe's Villages had an outreach where they provided the homeless individuals dentures, and they just did a really big outreach, and it was shown that how that changed people's lives. They were able to smile, they felt confident to go out, apply for jobs, and it was really quite touching. And not only that, but also poor oral health can lead to other issues, you know primary cardiac issues. And, once you have poor oral health, it's usually infection, and that you can become septic very quick. And there's just a whole host of other health issues that come from poor oral health. For the Healthy People 2030 objectives, one of their objectives is to increase oral health care in the United States, and they are meeting that goal. But this is just in the general population. They don't specifically single out the homeless individual, and I do not think that goal is being met. So on the needs assessment, basically how I found out what was needed in the Alta Loma neighborhood, and specifically the homeless population. And when I talk about my population, I'm not only am I talking about a geographic location, but I'm also talking about the population of the single homeless individual. So it's varied as far as, I took both of those populations into account. And, how it was determined what was needed was I went out on the foot team with Jeanette from the San Diego County Public Health Office, and we actually went down to the Salvation Army, and we were actually doing some immunizations, with the homeless people, and just looking, seeing them, seeing their teeth, you saw that quite a bit. And then also I worked with David. He is a social worker in the Oceanside Public Library, and we spoke quite a bit. And when I was with Jeanette and we were talking, and I was asking her about, what services are there for, the homeless adult in the way of dental. And she's one of the ones that initially pointed out, she says, there isn't a lot for the single adult homeless person. And she works with homeless day to day. She is out on the field with them. She works with the police department. She's very involved in the homeless population in the entire county. And so when I spoke to David, who does work specifically, in Oceanside, the Oceanside Public Library is just outside of my little Winchell neighborhood of Alta Loma. And so, he is dealing with the homeless individuals that are in that neighborhood. And he absolutely agreed that, there isn't a whole lot of options for the single homeless individual. So for the theoretical framework and needs assessment using the precede proceed model, to me, this was quite frustrating. Um, it was just, but I was able to work through it. And then when I was doing my proceed model, I feel like I finally got it, but it took a long time. It took all semester for me to actually figure it out, I felt. The pre-seed model, it guided me with assessing the needs of the population, the issues, behavior, or lifestyle. And the proceed model guided me with the actual intervention, budgeting, and outcome. So as I said, it did take me, unfortunately, most of the semester to actually figure it out, but I think I figured it out. So the issues we're dealing with, education and practice, within this population regard to the adult homeless and their oral health, what I found in my research was, a lot of, the homeless, what they have is what they carry with them. They don't have a computer. They don't have phones, a lot of them. They don't have a car, they walk, they don't have homes. They don't have any sink or, bathroom, available to them right before they go to bed. So they could go ahead and, brush their teeth, floss, or anything like that. And as far as making appointments, to go to the dentist, they can't just Google, where can I go for a dentist for a low-cost dental? How do I apply for Medi-Cal? Oh, let me get into my car and go to the dentist. These are all barriers that, prohibit an individual from getting good dental care. And so, with my education piece, what I tried to do is I tried to go ahead and, research. Okay, so this individual does not have anything. Are they able, is it effective for them to be able to just simply brush their teeth without toothpaste? And I found that yes, it was. If they just had a toothbrush, they're able to brush their teeth and they're able to get plaque off. And then I thought, okay, well, what foods can they eat with if they don't even have a toothbrush or toothpaste? And in researching, I found that they could eat an apple or celery, and that will go ahead and take the plaque off their teeth. And then the other item was where do they go for the free low-cost dental services? And so I went ahead and I created a flyer showing where they could go. I gave, I think, 3 options, which were very close to their Alta Loma neighborhood. And then lastly, the transportation was an issue. So I went ahead and from the senior center in the Alta Loma neighborhood, I went ahead and kind of decide, on these different locations where they would go for the dental, the dentist, I went ahead and put the bus routes so they would know it's like, okay, they would take this bus in order to get to this dentist. I didn't put the times because there are varied times. Okay, so here was my intervention. And in my proceed report, one of the things I spoke about was when educating the homeless people, it's not just like a regular population. You can't just go ahead and advertise and say, hey, be here, Wednesday night at 7 o'clock. Because, working with Jeanette on the foot team, one of the things I really learned was that the homeless population do not trust people easy. As I mentioned earlier, they have mental health issues, and it's not your average citizen that you can say, come for an education service. And so, once again, in my research, I found and my experience with Jeanette, it was, going out to them, going into their neighborhood because they're not going to feel threatened, and so, and I think they'll be more willing to, be open to the education that I would be giving them. So what I did is, as you can see here, is I created a flyer, how to care for your teeth. And I said, did you know that having decayed teeth can affect your heart? And I put the little references down there. And then that says places to go for, free or low cost. And then I put, 3 different locations. I went ahead and I put the bus routes that they would take to get there. I highlighted those. I have the phone numbers. And then I just went ahead and put a few comments in this section right here. This is where, if you don't have a toothbrush, you can use celery or an apple, and just different items right here, information for them. And and so what I did, and once again, instead of inviting them, I went and I bought a toothbrush. This was a good deal. It was 2 of them for $1.29, and that was at 99-cent store. I bought a bag of apples. So I gave individual that came into contact, or I educated, I gave them a toothbrush, a flyer, and an apple. And to me, that was very effective. One of the things that I didn't realize was that some of them just don't have teeth, and I just felt really bad because they said, "Oh, I would love to taste an apple again." And I said, "Well, you know what? Here's a place that you can go to, for dentures." They had 0 teeth and they couldn't eat the apple. And the other thing that I did recommend is I gave them a little bit extra. I said, go ahead, and if you know some people, give these out and tell them about this. And they were very open and welcoming to me. Okay, here was my budget. I didn't spend a lot of money, and a lot of times you don't need to spend a lot of money. I went ahead and, I created the flyers, and I went to FedEx to get them printed because I wanted them nice in color, and that was $8. They charge now a surcharge of $2.50. And once again, 99-cent store. I just bought 5 sets of toothbrushes at $1.29, and then the bag of apples at 99-cent store was $2.99 for a total budget of $19.44. So my project evaluation and outcome measurements, my goals and objectives for this project is that the individuals that I spoke with would take action, that they would keep the flyer. It's something, that they can fold up, keep in their pocket. They would go ahead and they could always have it with them, and they could look up the dentist's office and they could make an appointment, and obviously they would eat the apple and know that, if they didn't have their toothbrushes, that they could maybe have an apple if they could, get an apple somewhere. But they could also just use a toothbrush morning and night, once again, just a dry brush and get all the plaque off. And then the second objective I wanted them to spread the word amongst their community about the different options that are available to them, because it's hard to, reach obviously all the individual homeless people, but they have their person that they look up to, and they could, once again, they network no different than we network in our circles. And so the goal is that they would go ahead and spread the word. They could, show them the different phone numbers and the different, bus routes to go ahead and take them to the dentists. Okay, so the results and conclusions of this project, after, writing everything and submitting everything, there was some things that I was definitely happy that I didn't try to do this in the classroom because I don't think I would have received a single person. And something which I didn't plan for was all the rain. So that was, a little bit, tough to navigate through. And then also just the homeless population is a tricky population to educate because they don't trust easy. Sometimes, which I had mentioned, they're inebriated in my pre-seed paper. And I did find that, and I kind of bypassed those because they weren't alert enough to receive the education. But I do think this is a very, very important topic that needs to be spread. Thank you. And I think I'm almost at 15 minutes. So yes, so it was a very educational project.